from New Zealand. Am I right? I'm not
Sydney.
sure whether it's New Germany. There we go.
No,
All the way
Sydney.
from Germany is joining us. Thank you very much. And we also will have Mr. Tim Ekesa and Sinah Moruane on that. And now I am handing over to you, Willy, to take us through.
Thank you so much, Tozama. In Swahili, we say asante sana, which means thank you so much. Good afternoon, colleagues, and welcome to the last session of Day 1, 2022 African Child Trauma Conference. My name is, as my colleague Tozama said, Willy Buloso. I am the Regional Coordinator for Africa at ECPAT International. I'm going to facilitate this discussion around COVID-19 pandemic, national lockdown, and online child sexual exploitation.
Excuse me, Willy. Excuse me, Willy. Dr.
Yes.
Shaida Omar, please, can you mute yourself? Dr. Shaida Omar, please mute. Thank you.
Thanks. Can I go ahead, Tozama?
Yes, Willy. Sorry for that. Yes, you may go ahead.
Thanks. I will not lose our times today. My panelists have been introduced by Tozama, Dorine. Thank you so much for being there. I think it's almost 11 p.m. in Sydney, but you are here with us. Tim Ekesa, Director of Kenya Alliance for Advancement of Children, and Sinah Moruane, Child Protection Specialist, UNICEF, South Africa. Before I hand over to Dorine, I would like to say something about online child sexual exploitation. Unreported cases of child sexual abuse and increase in cases of sharing child sexual exploitation materials are among the effects of the COVID-19 pandemic, according to a recent report by Interpol. So some key social and economic factors that have affected online child sexual exploitation of children during the ongoing pandemic are closure of schools and move to virtual learning system in most of the African countries, increased time children spent online for social or educational purposes, and limited access to community support service and child care during the ongoing COVID-19 pandemic. So to discuss this, ladies and gentlemen, I would like to invite our first speaker, Dorine van der Keur, who is going to give us a global overview of the ongoing online child sexual exploitation and COVID-19 based on a research called Disrupting Harm Project, which is going to present us. Dorine?
Thank you, Willy, for the introduction and also for your emphasis on the importance to provide insights on the impact of COVID on online child sexual exploitation and abuse. So I would like to share with you a large-scale study on online child sexual exploitation and abuse, and it's called Disrupting Harm. So Disrupting Harm is a unique and groundbreaking study as we are implementing the research across 14 different countries at the same time, so that will enable us to do a cross-country comparison of the findings. And another unique aspect of the study is that we are going to work together, or we are working together, to combine the expertise of the 3 different organizations. So each of the partners, they have a particular focus. ECPAT will research the context, Interpol will assess the threat, and UNICEF will capture children's perspectives. The project is funded by the Fund to End Violence Against Children, and we intend to learn from this process and framework so that we also can adapt it and use it in other regions in the future. So currently we are halfway through the implementation of the study, and of course we had not anticipated COVID. This was an unforeseen event, and it has created both challenges but also opportunities for disrupting harm. So I want to take you quickly through the 3 different components. ECPAT will research the context in 2 phases. Phase 1 actually has already been finalized. This was a literature review and a legal review. Phase 2 is ongoing now, so that's the primary research, and it's being conducted in all 14 countries. We're interviewing senior government stakeholders from key ministries to understand the current legislative and policy environment. We're also collecting non-law enforcement data. So this is data that we can collect from the hotlines and helplines in the different countries and also from the industry. And we're also conducting surveys with social workers to understand the scale, scope, and context of online child sexual exploitation and abuse. And then we're interviewing victims and their parents, but also representatives from the justice sector on access to justice for victims of online child sexual exploitation and abuse. Finally, conversations with young female and male survivors to give them the chance to also be part of this research and to have their voices heard. Now, to achieve this, ECPAT members were mobilized in the 14 countries. You can see their names on the screen. And we also hired a team of international field researchers who we recruited and trained to conduct the data collection. Now, this data collection started for ECPAT in February of this year. And that was actually right before the COVID became widespread. So both the data collection and the ethical clearance have been delayed because of COVID. But thankfully, our donor, the Fund to End Violence Against Children, has graciously offered us to, or actually all three partners, to extend the deadline of the research with 6 months. But besides delays, ECPAT also had to make some changes in our methodology. So for instance, the data collection was originally planned to be conducted by the ECPAT members with support of the international consultants. But because of the travel restrictions, these international consultants could not travel. So now we work as much as possible with the ECPAT members and local consultants. And another change is that we have now are collecting some of the data remotely. So for instance, the interviews with government officials and the survey with frontline service providers is being done online. So these are two interesting changes in the methodology that we had not foreseen, but it works out really well. So this will be definitely something that ECPAT will start to do as well in the future for future research. Then we have Interpol. They're analyzing the threat via the collection and analysis of crime data. And simultaneously, they're also doing a needs analysis on the capacity of law enforcement agencies to fight online child sexual exploitation and abuse in the target countries. So the entire process will be underpinned by Interpol National Central Bureaus, the Interpol Regional Bureaus, as well as the Interpol Specialist Group on Crimes Against Children. Now, because of COVID, Interpol has also had to shift to remote data collection. But this has been going smoothly. And then we have the third component, which is UNICEF's component. So UNICEF Office of Research in Inocenti, together with the UNICEF country offices, they will ensure that children's perspectives are central via a cross-sectional, nationally representative household survey with children and their caregivers. So for UNICEF, COVID posed actually an interesting research opportunity as they were still able to amend their survey for some of the 14 countries. So they have been able to incorporate questions specifically about the online behavior of children during COVID times. Then in the third quarter of 2021, so next year, we intend to publish 14 national reports and 2 regional reports and also kick off a campaign. So we expect that Disrupting Harm will be able to shed light on the crime in Africa and Southeast Asia. But as I explained before, we were not able to incorporate questions on the impact of COVID in all 3 components. Only UNICEF was able to do that. So I would like to make some recommendations. So I think it's really important to get a good understanding of the impact of COVID on online child sexual exploitation and abuse. And I would like to stress the importance of resources to become available to do rigorous research in this area. And ECPAT strongly urges future research to also include the voice of children, as we have done with Disrupting Harm. But we need to ensure that no harm is done to children, because they're even now more vulnerable in these COVID times. Thank you. Willy, over to you.
Thank you very much, Dorine, especially when you say at the end of your presentation that consideration and methodology has been changed in order to protect children during interviews while implementing disrupting project activities. We are now going, thank you very much, Dorine. We are now going to have a South African perspective of NGOs and community working with children in the time of COVID-19, but on issue related to online child sexual exploitation. I'm going to invite my colleague Sinah Moruane, who is child protection specialist, UNICEF South Africa office. Sinah?
Thank you very much, Willy. Thank you very much for inviting me to do the presentation. I would like to share my screen and to also appreciate the fact that UNICEF South Africa is part of this session. But as I move on and move forward, I would like to really sort of urge all of us to actually frame the issue of the context of, OXI within the context of the guiding principles or the guiding instruments that we all know that actually promotes fundamental human rights, and the same applying to actually the rights of children. I'm not going to really mention that, but also to look at, the challenges or the requirement of the new normal, which is actually, the non-negotiables from COVID, but also to look at another issue of balancing actually the provision, the protection, as well as the issue of child participation as enshrined in the guiding instrument, but to appreciate the fact that, yes, the digital space has actually brought along a number of opportunities, but as we look at those opportunities, we should also be able to appreciate the fact that, children need to be protected. So that is very fundamental, and that is very... Can everyone see my screen?
No, Sinah, we cannot see your screen. But please go ahead. Go ahead if you...
Ask her to share her video. She's not sharing.
Should I go ahead? So can I request to them to actually sort of, share from your side, Willy, as we have it as well?
Sinah,
keep on moving.
Yes, if you have access to your PowerPoint presentation, you can go ahead and present.
Okay, thank you. Moving forward, what is very critical is that we should look at the different forms of risk that children get exposed to. The issue of children being exposed to the risk, where actually intentionally and unintentionally come across videos as well as images that are of sensational in nature, that actually expose them prematurely to some of the content that children should not really be, exposed to. The second risk being actually children themselves putting themselves at risk by sharing the videos as well as the images, of themselves actually being more, explicit about their body and their sexual, whatever inclination, which at the end of the day also put them at a risk. And the other way or the other option of actually, posing a risk being actually the children as being victims of, peer pressure or peer behavior, where children find themselves actually being exposed to cyberbullying. In South Africa, 61% of children in school indicated that they really sort of get, bullied, on the cyberspace, by their peers and the like. So this simply tells us that, there is a bigger challenge that actually children are being engaged to. And moving forward as well, we know for a fact that children also get exposed actually from perpetrators online who actually just go out fishing and stalking for our children in order just to really sort of, bring their livelihood at home. So all these are very critical issues that we need to look at. And moving to South Africa, or the context of South Africa, as we all know, children in South Africa also had an exposure actually to more virtual platforms due to COVID. And actually, they all also have opportunities. We have heard from one of the Web Ranger speaker who talked about how actually the digital space assisted them to stay connected. The issue of online gaming, the issue of navigation, and just the issue of fun, on online. But what also, COVID has actually brought to the fore is that, the issue of social and economic divide, the issue of inequalities in the country. UNICEF South Africa conducted a study, the U report, that was actually just to do a dipstick analysis of finding out on exposure to internet. And the discoveries or the findings were that 30% of children in urban areas do have laptops, but when we go to rural areas, only 9% of children in South Africa have, laptops or own laptops. And UNICEF Research Unit has just released, the findings of a study, which we have not really sort of put in public domain, but which actually indicated to us that 97.7% of children in South Africa actually have access to internet. But also what is disturbing is that actually, unfortunately, the end users, that is now the children, are actually not well informed of the legal prescripts that regulate the online behavior. So this is already a challenge to us. And also what was actually detected was that a lot of cases really came to the rise, the issues of abuse, the issues of depression, the suicidal tendencies. So this really gives us an indication that there is a lot that our children still need to really sort of confront. Moving forward again, then we need to really sort of indicate that in South Africa, we did really sort of have a chance to look at ourselves and look at the model of national response to just assess, the level of improvement that is actually, happening, or state of readiness in the country. And we are really able to share that, in South Africa, actually, as far as policies are concerned, we do have policies. We do have, your constitution, we have, the TIP Act, we've got, the Criminal Procedure Act, as well as the Children's Act. That all actually indicates what should be done in case, children are really vulnerable online. We have also the criminal justice that actually starts from reporting to investigation to prosecution, that is very clear, as well as, the services that are there. But what is important is to ensure that actually there is a coherence of support services as well, to ensure that children who are actually experiencing OXI are able to really get the necessary support. We have our helplines, we have our hotlines, but what is important is that we should work at a more coherent way of ensuring that we protect children online. Coming to the societal part of this model, which has 6 pillars, as you can see, as I can share with you, is that when we talk of the society, we say there is a lot that needs to be done. Prevention has been emphasized and emphasized and emphasized. And we are saying that there is a need to really sort of strengthen families, to strengthen actually and empower children, so that children can actually be, themselves actually disciplined and be the keepers of each other. Rather than actually even abusing each other, they should be able to empower each other to actually sort of be cautious of all the issues of, OXI, and be able to support each other. And moving forward as well, to the parents, we are saying it's very important for parents and caregivers to be empowered. They need actually to be informed, of the adverse impact of OXI. UNICEF research has just also indicated to us, that is not yet published, that actually, there is a tendency not to really sort of understand OXI well, because it's a virtual crime. It's not like your murder, your rape, and all other cases. But what is important is for us to really take the challenge and know that we need to understand it, and we need to ensure that we protect children from this, violent crime, because it is also a crime. Moving to the industry, there is a deliberate move in South Africa to actually engage, the virtual platforms. We are really looking forward to engaging, you know, Facebook, your Google South Africa. We are already working with them to say, actually, what is it that we can come, you know, up with and contribute more even, you know, for the protection of children as far as Oxy is concerned. And there is an appetite, a positive really appetite to ensure that, you know, we partner, we collaborate. And the same applies to media, where actually there has been some form of workshops and trainings to ensure that media does ethical reporting. I want to move to the actual partnerships that UNICEF is having. UNICEF, as mentioned by Dorine already, we are part of the Disrupting Harm, you know, study, but we are also, as UNICEF in the country, working together with government of South Africa, especially DST, you know, the Film and Publication Board and all other organizations to ensure that we actually capacitate the whole community, that is the whole nation, parents, children, CSOs, you know, frontline workers, teachers, everybody else on the impact as well as the effects of Oxy on children. So we are working together on that, and we have already developed, you know, the awareness raising material, we have developed the training material, and thanks actually to the support that we have got, you know, from the Global Partnership and the Global Fund to ensure that this work is actually carried out in the country. Coming to my last slide of recommendations, I would like to emphasize the issue of multi-sectoral collaboration. It's only when actually children themselves are empowered, when they have the knowledge in order to be able to really navigate the platform safely and positively, that we will be able to mitigate the impact of Oxy. But also what is important is the voice of children. The voice of children that can actually even be educating the parents, which can be educating the caregivers, which can also be educating other children. And for parents still need support, as we have all realized, that they need to be really sort of supported to be able to guide their children. And they need to be trained, and we need to ensure that we forever communicate safety tips in the interaction to ensure that children and parents are able to support each other. They should hold open discussions, and parents should be able to respond and report to any harmful content, conduct, and contact, so that then they can ensure that everybody is aware of what is happening on online, and to ensure that there are measures of protection to ensure that children are safe. All what I can say is that all actors, everybody else from the industry, private sector, from the frontline workers, government, CSO, parents, children, everybody else, we really need to collaborate and work together. This is the only way that we'll be able to deal with the complexities as well as the sophistication of Oxy. And this then brings me to my last slide of saying we really need to work together, we need to join hands, and we need to ensure that we respond to Oxy in our programs. As we map services, as we have heard this afternoon, we need to ensure that those services are also taking into consideration the issues of Oxy. Thank you very much. Over to you, Willy.
Thank you very much, Sinah. Thank you so much for sharing the experience in South Africa. This is a holistic question, and from your conclusion, we need collaboration between different actors working in the field of online child sexual exploitation. We are going to go to our last presentation, and my colleagues, Team Ekesa, will share the experience of Kenya, an experience outside South Africa, and then we are going to learn what Kenya, what civil society organizations and NGOs in Kenya are doing to fight online child sexual exploitation during the COVID-19. Team?
Thank you very much, Willy, and thank you, my other two presenters, Dorine and Sinah, for your very nice presentation, and the MC for doing a very good job. I'll specifically be able to be speaking about our Kenyan experience on COVID, on the issues that were being discussed, which have well been addressed by my two colleagues. And as Willy says, I'm representing the Kenya Alliance for the Advancement of Children, which is a national umbrella body for NGOs. It's a membership organization with over 250 members across the country, and with a number of statuses that we have. But I think the most important one for today is our membership to ECPAT, and we are part of the DH project that Dorine talked about. Then I'll just be able to share briefly about what is happening in Kenya on the issues of COVID, and specifically on KAACR, online child sexual exploitation and abuse. We know that as per last month, we had confirmed cases of close to 40,000 in Kenya and about 26 recoveries. And out of them, we are saying about 700 actually deaths. And of these deaths, we had deaths ranging from 4-month-year-olds to 82 years. So the children are affected. As a country, we've had a national lockdown since March 15th up to July. Then now currently with some partial lockdown, and this is causing a lot of trauma, not only to children, but also to adults as well. This has led to closure of learning institutions from 15th of March. And up to now, when we have a few tertiary institutions that are now being opened, and the likelihood of partial opening of primary and secondary schools next week. This has meant that many children, a few children were learning online, and only about 19% of the children were actually learning online. The rest were not learning. They were not in any form of learning, which means the principle of leave no child behind was actually being broken. And we've been doing a lot of work, as we'll come to see. Then this has led to increase of cases of, especially Oxy and class, and it was hacked 3 times. And pornographic information was actually splashed to children, which really caused a lot of trauma to them. As a country, Kenya has taken a number of steps to try and combat Oxy. There's a technical working group which we are part of on child online protection. We've also been very consistent with marking the Safer Internet Day, which is marked in February, and we did it this year. And the most important thing is that our Department of Criminal Investigation, which does all criminal matters and investigation, they now have a child protection cybercrime unit, which is very important to us because that can help us to trace Oxy cases. And more importantly, the KAACR has been established. It does a lot of work of detecting and preventing and responding to various cyber threats that our children face. And then we also, as a country, we pride of having a national plan of action, a 5-year national plan of action on Oxy, which we are implementing from this year. And as a country, as mentioned by Sunny, we are members of the We Protect Global Alliance, meaning that we work at ensuring that we reduce sexual exploitation of children online. As CSOs, we've made some efforts to protect children during this COVID. One thing we did, we've been engaged with children from the time March when there was lockdown, and we managed to prepare a report on the impact of COVID and COVID-19 pandemic on children, which we submitted to the 35th session of the Africa Committee on the Rights and Welfare of the Child, which took ordinary session, which took place virtually in August, September, majorly focusing on issues of, and more importantly, recommendations for children to them this time where there's too much trauma. Secondly, we've been able as agencies to lobby national media and even regional media to be able to create spaces and opportunities, be it on print, electronic, and even digital media, to be able to engage children on issues of impact of COVID and children as a new partnership for child protection in this country. And we can pride that right now we have a national station that has committed 1 hour every week just to be able to engage children on their issues of protection and also issues of KAACR. And it's been a very interesting program for parents, for policymakers, and even for children themselves. Then we've made use of virtual media platforms, given that of keeping social distance and we are not meeting. We've been able to use Zoom, MS Teams, and even Google to be able to ensure that we prevent KAACR and we also mitigate, especially together CSOs and as government line ministries, private sector, and also as and engage children. As CSOs, we've been able to create a circle of care for protecting children and putting children first. What have we done? I think as a country, we value child participation in a very big way. We've had a lot of regular sessions with children on online safety, especially at this time that we are doing the DH research. We've been engaging them on talks to talk about the uncomfortable online materials that they think they are not good. we've also been trying to work so much through these media programs to manage the children's screen time so that we can be able to realize the best interest of the child. How much time do they spend on screens, and how much time do they spend on other activities? Then finally, we've also been able to use this time to familiarize children on online and mobile services that are available, be able to see what kind of tools they use and how to can create or be able to make the best of them rather than being able to misuse them. Then finally, we are saying that spending time with children, it actually reduces, when they are online, it helps them to explore more and be able to look at the positive things that they need to do. As I come to finish, I think there are a few recommendations we want to make on how to keep children safe from OXE at all times and everywhere. One, raising awareness cannot be gainsaid on OXE, and awareness to children, to parents, to caregivers, to protection officers, just like the previous panel was discussing on alcohol, awareness is a big thing for us. Then secondly, building capacity of law enforcement officers on investigation as well as to, prosecution of OXE cases. That was a place, and even resourcing some of those government bodies that are dedicated specifically on OXE issues. Then thirdly, providing services, especially on care and support of children who are at risk and children who are survivors of OXE. It's a big service that we really recommend. We can do it for Africa and even for other countries and people represented here. Thirdly, obviously, the legal framework is very important for us. We advocate for a legal framework that criminalizes all forms of OXE, including online grooming, and especially also looking at some of the CRC protocols, especially the second OSHA protocol on the sale of children, child prostitution, and child trafficking. As Kenya as a country, we've not ratified it, and it's one of the lobbying areas that we are pushing the government to. Then thirdly, we need to lobby and strengthen cooperation and collaboration with private sector. Internet service providers, mobile operators, innovative tech companies. We want to see how they can be able to take measures to provide safe online environment for children. Then finally, this whole issue of implementation. We might have very many good laws, but I think the area of implementation is where we are doing so badly. If we did all these things, we know that we'll be able to ensure that no African child is left behind, and we can be able to resist any OXE trauma-related situation that can be able to face our children. Thank you very much.
Thank you very much, Team Tozama. We are at the end of our panel, but allow me to summarize or conclude this at just 1 minute. During the ongoing COVID-19 crisis, we have seen 3 facts around online child protection. The first one is there is increase in cases of online child sexual exploitation. The second, we do have a decrease in reporting offenses due to quarantine and other measures. And the last one, access to support. There is decrease in access to support because of quarantine and people are working from home. And to summarize this discussion, the 3 presentation, I would like just to pick 3 things that have been said by Tim, and that has been also said by Dorine and by Sinah during their presentation. The first one, and this is a recommendation, we need to work together in synergy. This is, as I said before, a holistic problem, which means a holistic approach as a response. Let's continue together to raise awareness on online child sexual exploitation. Let's continue to build capacity of law enforcement officers and all actors involved in online child sexual exploitation. And finally, let's advocate for legal framework that criminalize all forms of online child sexual exploitation, including the new manifestation that we have learned during the ongoing crisis. That being said, I would like to thank you, my panelists, Dorine, Sinah, Tim, and I would like also to thank Jerry Benz for the opportunity. Thank you very much, Tozama. I give you back the floor.